In the clinic, I see children who are affected in many different ages and with many different issues. The parents often bring issues of problems with behavior, problems in school, and frustration with the school not being able to help them and help them academically as well as behaviorally. Kids being classified as bad or bad behavior or EBD kids when no one's recognized that they actually have a disability.
It used to be FAS and FAE, and now it's called FASD. It's fetal alcohol spectrum disorder, which means that it could be one end of the spectrum to the other. It could either be severe or it could be very mild, and they could function at a really high level.
Fetal alcohol affected children look very normal, and usually they talk very well, where it's not visual at all compared to my 14-year-old daughter, who you can see clearly she's slow, there's something wrong with her.
He looks so normal. Unless you have raised children with fetal alcohol and you know some of those facial features, you would just look at this child and go, there's nothing wrong with you.
When you meet him, he is the sweetest little thing, you know, and you can't see it.
The nurse asked him when his birthday was, and he does not know. He's almost 9. He doesn't know when his birthday is. He just looked at her and said, I don't know. And she said, come on, you know. You got to know when your birthday is. And she just kept harassing him. And this was just a little conversation. And I interrupted and I said, I'm sorry, but he really doesn't know. I said, he has some short-term memory loss, and he just doesn't know.
It is not their inability to actually hear like a deaf child, but in a sense, their brain is deaf.
My daughter can do the times tables perfectly. And then 2 weeks later, we sit down and try to do them, and even I got frustrated with her, saying, you knew him a week ago. Well, I don't know him now.
We had to teach our youngest daughter that a number 4 was the same number, not quantity. This isn't about teaching quantity. This is about teaching how it looks on a clock on our stove versus a clock on her wall. If the number was just a little bit fancier in script, if it was shaped differently in any way, it was not the same to her. She had no recognition of it.
These children may hear one word, the third word, fifth word of a sentence, and then they just fill in the blanks.
She has sliced her finger open on more than one occasion by putting the pressure on the blade and having it be on the wrong side. And most people at age 13, they would quickly start to feel the pressure, the discomfort, and the pain as that blade is cutting in, and they probably wouldn't make that mistake twice. For my daughter, she will make that mistake repeatedly.
We do have to repeat a lot of stuff to him, you know, and my daughter, she goes, when she keeps, because he'll say, huh, you know, and she just gets frustrated and says, I'm not saying it anymore, Mom. And I said, but you know what, then say it a different way, because he's not getting it that way.
They don't learn by osmosis or even experience. They can make the same mistake 5, 6, 7, 8, 9, hundreds of times. Hundreds of times.
It has to be retaught, repetition every day. Yeah. Because they do have holes in the brain.
My daughter was approached 625 times before she was able to grasp the concept. If you think about how many times we have to then humanly try to approach it in a consistent manner for these children, that's amazing.
He's got aggression problems and violence issues, and I can't tell you how many holes in the wall I've repaired from my 8-year-old son already, and it's only getting worse. And but on the other side of it, he's the most caring and empathetic child. He loves animals. He can tame a stray cat. He has tamed stray cats. He's just got a gift with animals, and with young children, he's very good. He's so sweet. You know, we call him Jekyll Hyde a lot of the time because he can be the most wonderful boy, and then he just trips and he's out of control.
Medically, he's on 4 different medications, but when the rages come, it's very difficult to control. Well, you can't control what comes out of his mouth, but also to control him physically. And we're working on handling him and keeping him safe from himself. He inflicts his injuries on himself and then threatens us. Ruins a lot of clothes and things in his room.
You know, it's a daily challenge to try to teach him, okay, you're losing control. You know, okay, I can see you're clenching your hands right now. That usually means you're getting frustrated. Do you feel kind of frustrated? And you try to talk him through, and it might be too late by that point.
Most of it comes when he's being told he can't do something he thinks he should be able to do. And it's usually because of his vulnerability and his disability that we need to keep him from doing something.
He's 8, he's 120 pounds. He's a big boy already. How long can I keep him, how long can I keep everyone safe, including myself? Because when he was 4, he would kick me and I was black and blue from a 4-year-old, just trying to keep his rages down until we got him medicated.
She is able to follow rules somewhat. There are some days when she follows them better than others.
He's constantly being coached on social skills and being supervised because of his impulsive behaviors and his lower IQ.
She was trying to be helpful at a ball game, and the ball went over the net and went into the street, and she ran out to get the ball. Didn't even think about looking for a car. And most people think this is pretty normal, but it's not that normal for someone who's 12 or 13 to do that, and it's still occurring.
She wouldn't understand, even after numerous lessons of not talking to strangers, of not accessing strangers on the computer, that this person could harm her.
I've even had social workers that have come to my home, and the girls will come and crawl up on their lap, and the first time they've met them, and that's very inappropriate. But I've even had workers that didn't say, "Oh, wait, it's nice to meet you," and give them their hand instead of saying, "You really shouldn't be on my lap, little girl, and snuggling up to me. This is not normal." It just sets the girls up for terrible vulnerability in being taken care of and being predated upon.
If you saw a snapshot of her, she's a beautiful, very capable looking young lady who has many strengths. She's very good at athletics and all sports. And she's very vivacious, happy, go lucky for the most part. People find her very charming and engaging. They can't see what we live with every day.
There aren't very many people that know about fetal alcohol in Minnesota. There are very few, in fact, and there are very few people doing assessments, and that's part of that whole thing about getting people to understand this issue and take the time to learn about it. And many physicians